Hi guys, so I'm going to be talking about calcium supplementation in younger children for our final project. So just a quick overview of calcium. It's the most abundant mineral in the body. It makes up about 40% of all nutrients. Calcium can be lost through the day through urine and feces, but can easily be replaced by the diet that one eats. Foods with lots of calcium include things like dairy products, yogurt, almonds, seeds, sardines, beans, lentils, and plain foods. Calcium works together with vitamin D to effectively be absorbed, and some functions of calcium include things like that it's critical for the formation of bones and teeth. It helps in the formation of blood clots. It aids in muscle contraction, aids in sending signals from the nervous system, and regulates cellular metabolism as well. So here's the daily requirements for each age population of people. So kids 1 to 3 years old only need 700 milligrams per day of calcium. Kids 4 to 8 years need 1,000 milligrams per day. And then from 18 to 70, it's around 1,000 to 1,200 milligrams per day. But I'm really only talking about the younger kid population, so 1 to 8 years pretty much. So calcium deficiency and toxicity. If you have a calcium deficiency, it usually develops with lack of calcium intake over long periods of time, and it develops in the form of osteoporosis. Some symptoms of calcium deficiency might include muscle problems, dental problems, and extreme fatigue. On the other hand, calcium toxicity is usually only present in people taking calcium supplements. The calcium supplements can crowd out other important minerals in the body and decrease the rate of absorption. Calcium toxicity can also interfere with antibiotics and can increase the risk of disease, kidney disease, and possibly an increased risk of cardiovascular disease. So, since calcium is linked to strong bones, one might assume a young child needs lots of it while growing. So the question would be, do calcium supplements help the child? Do they hurt the child? Or do they really not affect the child at all? In one article that I found, it was a study published by Obesity, a research journal. Calcium supplements were reviewed to see if it helped play a role in the weight loss of young children. The study was a meta-analysis of randomized controlled trials and was used to examine bone density outcomes after the children were taking calcium supplements for a while. And at the end of the study, the results strongly suggested that calcium supplementation had no effect on the height, weight, or body fat or lean mass of the children. So overall, no effect on the growth of the children. Another study I found was published by the BMJ. It examined the effectiveness of calcium supplements to improve bone mineral density in healthy children. The study again was a meta-analysis and included 19 different studies. The results of this one found that calcium supplementation had no effects on the bone mineral density of the neck and spine of the healthy children. However, there was a small increase on the bone mineral density of the bones of the limbs, but not really enough to make a difference now when they're young, or not enough to make a difference in preventing osteoporosis later in life. A final study that I looked at was published by the American Journal of Clinical Nutrition, and this one looked at calcium supplementation and how it might affect children from Gambia who are already accustomed to a low calcium diet. So the children in this study had poor health, delayed puberty, and low bone mineral content as well. Throughout the study, each child was given 2 chewable calcium supplements a day for 7 days. And after the study was over, the results showed that the supplementation resulted in a higher bone mineral content and density for the children, but had no effect on their height, weight, or bone widths of the children. So overall, usually calcium supplementation is not needed for children living in developed countries like the United States, because they're usually able to get enough calcium from their diet, and you don't want to go over what the recommended amount is, because then you can get that toxicity. But calcium supplements are useful in situations where a child obviously does not get enough calcium from their diet, such as the children from Gambia. So overall, just like any other supplementation, you want to talk to your nutritionist or your doctor before taking one and review if you need it in your diet and if it's the right fit for your healthy lifestyle. And here are my references. So thank you for listening.